Welcome to Adapting Class, and thank you for deciding to join us. So, some few questions I saw on my queue bag, and very interesting questions. I call them most mixed questions. But the reason why, because of the way it's easy for you to pick a wrong answer. So, let me show you what I'm talking about. This is the first question. You've seen this before multiple times. You know everything about it. But you have to step back, have a strategy, approach the question, figure out what the question is asking, and then try not to be trapped, right? Is that which male choice is most appropriate for this client? The buzzword is the male choice. So which of this is the most? All of them may be okay, but the word is most appropriate, and it's a male choice, right? And it's good for a client experiencing with acute mania episode. Then you have to bring your content. Figure out what is maniac episode. That means the patient has bipolar. And you know, when the patient has bipolar, basically they're exerting energy. They're all over the place. They don't sleep. They don't take care of themselves. Self-care, neglect. They don't eat anything. They just keep on going and going and going. And based on your content, I've underlined the buzzword. What is being asked is male choice the most. What is your buzzwords are acute maniac episode. Those are the one you focus on. Don't focus on any other words, right? Maniac episode, male choice. That means I need to give them certain food that will help them. Then you bring your content. What do you know about mental health, about bipolar disorder? They need high calorie diet, high calorie, and a finger food. Those two information is your key. Those are the ones you're going to use to answer the question. And you ask yourself, which of these food listed is a finger food? That means I don't have to sit down and eat. I don't have to use a spoon. I can use them with my hand, and I still be doing what I'm supposed to do. At the same time, it's still providing me with a bunch of calorie. That is the key. If it's not giving you a lot of calorie, protein, then you have a problem. Fried chicken and rice vegetables, stew, you have to sit down. At least you need some spoon to be able to eat with it. Salad, meatballs, and spaghetti is a mess over there. The guy cannot stay still. You can't give him a spaghetti to eat. You need a fork to eat with it. The meatballs is going to be a problem. He's not going to sit down and do that. Cake, fish, fillet, and cornbread versus vanilla pudding, milkshake, and burrito. Think about it. Which one is the most appropriate for this particular patient? If you look at it, cake is very small. You can walk around and eat it and have a lot of calorie from it. Fish fillet, the same thing. You can just hold it and eat it. It's getting a lot of fat from it. Cornbread. So there's a bunch of protein going on. There's a bunch of fat, and there's a bunch of carbohydrate. If you look at the last one, vanilla pudding, milkshake, and burrito, most of them are all carbohydrate. There's less carbohydrate and sugar. You don't have protein and other things to provide in the best energy. So the right answer is 3. You're more likely to choose number 4, but based on the amount of content associated with that food, 3 is more likely to provide him enough energy so that it does not get weak. And this is why it's easy to mix this question, because you probably choose 4, but it does not have enough calorie compared to number 3. So this is some of the things you have to pay attention to. You say you know the answer, but a little bit of tricky stuff that you got to pay attention to. This is also another content you have to know, like near death, right? This is one of the health promotion stuff. Near death, you have to know how to take fundamental aspect of it. Which of the following findings should the nurse expect during imminent death? That means you're ready to die in a few seconds. So things changes, right? When you're ready to die, the content related to near death is your metabolism goes down, things start to slow down to the time you want to die. As the last seconds of dying, the few minutes, everything is going to go down. So the urine output is not going to increase. Urine output, you don't expect the urine output to increase. So this is gone. Everything I'm focused on is imminent death, test taking strategy, right? And I know the content that your metabolism is going to go down, your respiratory rate is going to go down, circulation is going to go down, everything, GI symptoms is going to go down. So you not be able to swallow. You can't control your bowel. You can't control your bladder either, right? Your skin is going to modeling, right? But this is the trap. Just because things are going down, think about the pathophysiology. Your skin is not going to get cold. You have vasoconstriction. So there is vasoconstriction, less blood perfusion. There's less blood perfusion to the skin. So when you think about when you are in shock, your skin become cold and clammy. It's not cold and dry. That is the key. This is the trappy one. It's not going to be cold and dry skin. It's going to be cold and clammy. So watch for that. This is the trap. So this is the wrong answer. This is the wrong answer. So these are is a select or apply. Another strategy. This is select or apply. You don't have to pick everything. Just pick those that you know you're confident about. And don't be greedy. Just pick, if you know to, just pick it and keep on moving and pick up the point every question. But don't be greedy and say, I need to get all four of them right. If you pick more than four and then you lose a point, you get three out of right. So 2, 3, 4, and 5 are right answer. 6 is a trap. And that thinkless way. That's what I'll talk about in test taking strategy. This is another one, another trappy answer, trappy question, but it's the content space. Which of the following recommendations should be included in the teaching, right? A nurse is providing education to a client on lifestyle changes to reduce what? The risk of coronary artery disease. It's a bunch of words. I always say, when you're reading the question, go for the buzzword. They say, which of this, which your recommendation, which you include? What is the problem about coronary artery disease? And it's the lifestyle changes. Lifestyle changes. These two are all you need. Those are the buzzwords. Lifestyle changes regarding coronary artery disease. And then you say, what is coronary disease? Anything that affects your blood pressure, okay, your cholesterol, your weight, all these things, diabetes, all these things, all related that can lead to coronary disease. There is certain criteria you're supposed to know to figure out what you need to know to reduce the individual risks. If you know these answers, you can put it in. But which recommendation should the nurse include or prioritize? Which of them? Should you engage in moderate exercise for 70 minutes per week? Do you increase your dietary fiber intake to 20 to 30 grams per day? Do you reduce your tobacco use to 1 pack per day? Do you limit your sodium intake to 2 grams per day? These are head promotion questions that you're likely to mix it because of the way the answers are. They can trap you with that. You think you know, but then you don't know. How do you figure it out? Bring your content. Like I said, test taking strategy. Bring your content related to coronary disease. So, what do you think? Which of this is appropriate to remove and prevent coronary disease? It's straightforward. We all talk about exercise. Well, to avoid heart problem, we call it moderate exercise. Engage in moderate exercise 3 times what? A week. But what does that mean? 3 times. So Monday, Wednesday, Friday. You have to know this 3 times a week. It means each of them, you just need 30 minutes. 30 minutes, 30 minutes, 30 minutes. That's all. That is enough. 30 minutes per week, 30 minutes per day, right? 30 minutes per day, 3 times a week. So at least if you don't get at all 90 minutes, 70 minutes is not enough. The best one is 150. 150 minutes per week is your best. But if you don't get at all, get 30 minutes per day, a day times three will give you at least 90 minutes per week. 70 minutes is not enough. Increase your dietary fiber intake. Fiber intake is related to cholesterol. You lower your cholesterol, and cholesterol is related to coronary disease. Any single tobacco is a problem. No tobacco. Reducing it to 1 pack per day is negative. And sodium should be 1.5 grams. 2 grams a day is too much. So you know why you can make this question easily? It's because of that. These are really tough questions. These are designed to bring the content out of you. So if you see it in the question, I want you to know these numbers, and then you can answer this health promotion question. So the right answer is number 2, because your fiber 20 to 30 grams, and this will increase your cholesterol and help with decreasing your coronary disease. Which of the following orders the nurse you anticipate? A nurse cares for a client with suspected preterm labor. You have preterm labor. So the buzzword means you have preterm labor. Then you go with your content. Anticipated. Once again, I try to answer the question straightforward. You don't have to like guess or anything like that. Ask yourself. Preterm labor means you are in labor. Okay. And the baby is not due, right? Less than 37 weeks, greater than 20 weeks. What is the problem with preterm labor? We want to stop labor. Therefore, what do you want to do? Which of this is going to stop it? Amniocentesis is going to cause more contraction. You see the strategy? Contraction stress test is going to cause more contraction. Non-contraction test, is less invasive. It will give you some information. You see how the baby is doing, the well-being of the baby. If you give them pitocin, they're going to contract and the baby come out. The purpose of preterm labor is to stop contraction. Therefore, 3 is the right answer. You can see. So it's all following the same theme, and you follow for the same theme, you can eliminate each answers one by one. And let's care for a client with what? Dehydration, right? Which of the following assessment findings are consistent with the diagnosis? You see, straightforward, simple, straightforward question, no too much words. And so you go for the buzzword, dehydration, finding consistent. Then you ask yourself, what should I see when the patient is dehydrated? That means they are fluid down. Do you expect their pulse to be what? Bound in? No, it's going to be thready, right? Do you expect the central venous pressure to be 15? No, 15. Central venous pressure is 2 to 8. 15 is fluid overloaded. Do you expect their urine output to go down? Yes. Do you expect their skin texture to be poor? Of course. Do you expect them to have crackles in their lung base? No, that is fluid overloaded. Therefore, this is fundamental fluid electrolyte. If you need videos on them, I have a bunch of them. Some of them are free, but these are content concept. You cannot pass the NCLEX without mastering the concept. It's the concept you use to answer the question. You can watch thousands of videos, whatever they tell you. If you don't understand the concept, it will be hard for you to answer questions appropriately and get more points. You see what I did? I said dehydration, fluid over down. Therefore, I'm looking for answer to indicate fluid down. There's some concept you have to know that when your fluid is low, certain things will show. And that is what you can pick these select or apply questions easily. So those are the right answers. Now, this is also a trap. Okay, it's also a trap question. What is the most appropriate nursing action to relieve the itching? I always say buzzwords, but I mean what I mean when I say buzzwords. When I ask you a question, there's one word I put in it. I want you to focus on it. To relieve what? The itching. It's itching. So whatever answer you pick, it should take care of this. If it doesn't, do that, then you are not answering the question. Pick an answer choice that is going to relieve the itching. It's not just talking about something else. A nurse is caring for a client with radial fracture. After cast placement, the client complained of itching inside the cast. His hand is broken, wrist. They put the cast on, and he said he's itching. What would you do to relieve the itching? The answer choice should address the problem. If it does not, then you are picking a wrong answer. Inform the client that itching is a sign of fracture healing. Yes. When your fracture is healing, it's going to itch. Every time you have incision is healing, it's going to itch. You're going to have some itchiness associated with that. But it does not address the problem. Do something. What action? The question say action to relieve. Action to relieve. Just telling him this is there's nothing you can do. It's not appropriate. It's not therapeutic. It does not relieve the client anxiety. Next action to relieve the anxiety. Just telling him, hey, good luck with that. Because your wound is healing, that is not, it's not enough in that situation. Giving them ice to cast, apply an ice pack on the cast for 10 to 20 minutes. This will decrease the inflammation, it will numb the skin, and that will somehow help with the itching. Check the client fingers for signs of irritation. It does not address the problem. Checking for irritation does not, I'm not saying the kid has compartment syndrome. He said AH. So address that problem. Don't pick it because he said fingers looking for compartment syndrome. It's a trap. And of course, number 4 is worse, right? You don't put anything under the cast. So the best answer is number 2. Give them ice on the cast. It was going to numb it, and that will help with the itching. So there's a reason why I said this is commonly missed. Is because most people will pick this. They're thinking, "Oh, I'm worried about compartment syndrome." If I'm worried about compartment syndrome, I'm not going to ask you to look for irritation on the fingers. I will check. I would say check for pores, right? Perfusion to see if there's any compartment changes. So this is the little things they put in the question. You get trapped with it. What is the next priority action? Prioritization 101. Be sharp, right? Breathing, electrolyte, shock, sepsis, airway, and pain. And pain that is going to lose your life and limit my eyesight. What is the problem? A nurse is caring for a 5-year-old client with leukemia who has been receiving chemotherapy for 1 week. All of a sudden, his platelet is 30,000. You know that's a critical value. It's a bad problem, bad problem, bad problem. What are you going to do? Prevent bleeding. In the B sharp, that is what? Shock. If you don't do anything, this individual will be in shock. What are you going to do? Give him oxygen. The question never mentioned oxygen saturation or anything like that. It sounds good to you, easy to pick. It does not answer the question. It's a test-taking strategy. Give them aspirin. What? A platelet of 30,000, aspirin is contraindicated. Therefore, you left with 3 and 4. Iron does not address platelet. So even if you have no clue, you see what I did? Eliminated the answers. What is left is encourage quiet play. That means you don't want them to do something to trip or broke their leg and they bleed. Therefore, the right answer is quiet play. So number 3 is your right answer. Read to the following questions the nurse should ask. This can be really hard. And this is assessing a client with suspected preterm labor. So we suspect that the client has preterm labor. What are you going to ask the patient? What do you think? This is a content space. Think about it. If you taking care of a patient who is in preterm labor, what are you going to ask them? You suspect that. Are you going to ask, are you experiencing contraction? And if so, how often? Or are you going to ask them when is their first pregnancy? Is this your first pregnancy? Or whether how far along are they on their pregnancy? And when is their last sexual intercourse? It's a little bit trappy, but think about it. The question say preterm labor, suspected preterm labor. And we saw one question. The priority for preterm labor is to stop contraction. So I want to know how fast are they contracting, whether they are in active labor and I cannot do anything anymore, rather than trying to figure out if they are 20 weeks old, 13 weeks, or 14 weeks. It's not relevant right now. The first thing is, are you actually in true labor? Your contraction coming regular? All those things is very important. So this question is a little bit tricky, but you have to go with the buzzwords as preterm labor. And since he's in labor, you got to make sure the patient is in true labor. And if he's in true labor, are they in active labor? Or they far away along the like 100% phase or 10 centimeter dilated, and you cannot stop it. Therefore, asking them about the crack contraction and how often is more important than knowing whether this is their first pregnancy. It does not address the problem. It does not help if this is how far along they are with their pregnancy and whether this is whether they have sexual intercourse. Of course, sexual intercourse will stimulate contraction. But number one thing is figure out if they experiencing contraction and if how fast are they going and how often so that you know you can stop the contractions since they are in preterm labor. Which of the following is a priority safety measures? A nurse is caring for a newly admitted ventilated client in the ICU. What are your buzzwords in this question? Priorities, safety measures, and ventilated patient. That's all. If I'm answering this question, that's what I'm focusing on. Patient is ventilated. And what? What priority safety measures would I do for this patient? Do I suction them regularly every day or interval every 2 hours, every 3 hours? Do I put the wrist on restraint so that they don't pull the tube and then we have a problem? Or do I lower the ventilator alarm so that to provide a quiet environment? Or I keep a manual resuscitation bag at bedside? This is respiratory content right there. You have to know what you need for every patient that has a ventilator. As a nurse, there's certain key things you have to do. Do you suction them regularly? No. Suction is as needed. That is the content. So you don't get trapped with number one because, oh, suction is going to improve the airway. No, every time you see question about suction, tell yourself it's a PRN as needed. I don't suction every day. Wrist restraint. You should not restrain. It's as needed. You don't restrain the patient because you're afraid of what? Extubation. No, they're on sedation. And never turn the alarm down because you don't know if there's a high pressure alarm, low pressure alarm, and you turn it down. Well, you're not going to hear, and the patient is going to be in trouble. Just by elimination, number four is right. You always want to have a bag prepared for emergency so that if something happened to the ventilator, you can manually ventilate the patient. And manual ventilation is to have a resuscitative bag at bedside so that you can disconnect them from the ventilator and vent them. These are critical thinking questions. They're test taking strategy question. You have to think about it, but you can't answer it without the buzzwords, and you have to focus on it. Safety measures and ventilated patient. When the patient is ventilated, of course, I'm worried about self-extubation. Of course, I'm worried about mucus plug. Of course, I'm worried about giving them some environment to be able to not to affect their recovery. But we don't turn the machine on because of that. We don't restrain them because they're going to extubate themselves, and we don't suction them regularly. We suction them as needed, restrain them as needed, and we don't put the ventilator alarm, we don't change it, we keep it the way it is. And what we need is a manual resuscitation bag so that when they are in trouble, we can manually ventilate them and we are 100% sure they're getting oxygen. It's different from the ventilator. You are not sure. It's a machine. So that's that. And the last question. And this is providing preoperative teaching to a client awaiting gastric bypass. Patient is going to have gastric bypass. Just by that, the buzzword of gastric bypass should tell you this patient is overweight. And then what teachings you should prioritize. Whenever you do surgery, post-op, I have videos on post-operative care, perioperative care. There's specific things you should know about, and it will make you picking answer choice easily. Always you want to prevent complication right immediately post-op. And then respiratory status is number one. You want to prevent DVT. You want to prevent infection. All these things are very important. So teaching the individual of incentives perimeter A is a long problem, right? Pain control. Yeah, I'll control your pain, but your lung will take precedent, right? Discuss post-operative that modification. Of course, that's the trappy answer most people will pick. It's a gastric bypass. You want to prevent damping syndrome, but those are long-term effects. The immediate effect is to prevent a leakage and the pulmonary complication. Discuss ambulating techniques. I know you can walk, but the most important is your lung, and worry about your lung. So proper teaching of the incentives parameter is the best answer. So these are 10 questions, test taking strategy, adapting class way. The video. Thank you for watching, and then um, happy Valentine's Day. Good luck in your exams, and keep charging as always. If you want more, you can join our membership, or you can go to YouTube. There's a bunch of videos on my channel. Good luck. Best of luck.